Blood cell production follows a precise block-by-block progression. In hemopoiesis, cellular morphology dictates functional destiny, with every change in a cell's internal machinery serving a specific physiological requirement. This entire process occurs within discrete anatomical spaces, arcs supporting islands, or cords, of differentiating blood cells packed between clear adipocytes. Interspersed are sinusoidal capillaries. Their discontinuous endothelial lining creates gaps, allowing mature cells to exit into the circulation. The marrow acts as a controlled gatekeeper, restricting immature precursor cells within the stroma, while allowing properly differentiated elements to cross the endothelial boundary. Every formed element in the blood originates from the pluripotent Hemopoiesis stem cell. These cells maintain the marrow population through asymmetric division, self-renewing while simultaneously producing daughter cells committed to specific developmental pathways. This lineage map tracks the differentiative stages of all circulating blood cells, beginning with that central pluripotent stem cell at the top. The first major developmental event is a bifurcation into two separate progenitor lineages, the myeloid and lymphoid lines. This split separates the production of innate, tissue-level defenders from the highly specialized adaptive immune cells that will eventually populate the thymus and lymph nodes. Following the myeloid branch leads to erythropoiesis, the pathway dedicated to red blood cell production. Erythrocyte maturation follows a consistent pattern. As the cell develops, it sheds its transcriptional machinery, resulting in a sharp drop in RNA concentration as hemoglobin synthesis rapidly scales. This shift is visible in the transition from proerythroblast to basophilic erythroblast. The high density of polyribosomes required for hemoglobin synthesis binds basic dyes, turning the cytoplasm an intense blue. As accumulating hemoglobin avidly binds acid dyes, the cytoplasm shifts to a uniform pink. Terminal differentiation involves the total extrusion of the pycnotic nucleus, leaving a reticulocyte that matures in the blood. This entire sequence is driven by erythropoietin, a glycoprotein growth factor secreted by the kidneys when oxygen levels in the blood decrease. Erythropoiesis functions as an uncompromising factory line, sacrificing the cell's nucleus and organelles to create an optimized gas transport vehicle. Transitioning further across the myeloid branch, we reach the granulocyte line. Granulopoiesis is defined by a two-stage Golgi assembly line. The first stage is the promyelocyte, where the Golgi apparatus packages primary, azurophilic granules, modified lysosomes containing general hydrolytic enzymes. At the myelocyte stage, the Golgi shifts production to secondary, specific granules. This allows for the visual differentiation of neutrophils, eosinophils, and basophils based on their unique chemical contents. Maturation concludes as the nucleus indents to form a metamyelocyte, elongates into a band cell, and finally segments into its mature multi-lobed form. Granulopoiesis sequentially arms the leukocyte, first with generalized enzymes and then with selective chemical weapons. Thrombopoiesis, the generation of platelets, begins with the megakaryoblast and is driven by the hormone thrombopoietin. Before producing platelets, this cell undergoes endomitosis. It doubles its DNA through repeated replication without dividing, creating a massive polyploid cell, 150 micrometers in diameter. Within the mature megakaryocyte, a fast network of demarcation membranes branches throughout the cytoplasm, providing a reservoir for rapid membrane expansion. The megakaryocyte extends long proplatelet branches through the gaps in the sinusoidal endothelium, where functional cytoplasmic fragments are pinched off directly into the bloodstream. These pre-packaged cytoplasmic fragments lack a nucleus, functioning as the body's primary clotting mechanism after being mass-produced by the sacrificial megakaryocyte. The histological stages identified in the marrow predict the patterns observed on a peripheral blood smear. The reticulocyte count serves as a primary indicator of marrow function. High counts in an anemic patient demonstrate that the marrow is actively compensating, whereas low counts suggest a production failure. During severe infections, the demand for neutrophils causes mature cells to dump from the marrow's storage compartment into circulation. This depletion forces the premature release of immature band cells and metamyelocytes from the maturation phase, clinically identified as a shift to the left. Malignancies are categorized by these same structural principles. Acute leukemias are characterized by an overproliferation of immature blasts, while chronic leukemias involve the overproduction of more mature forms. Diagnosis utilizes two specific procedures: a bone marrow aspirate to evaluate individual cell morphology, and a core biopsy to examine the overall architecture of the stroma and hemopoietic quartz. The clinical presentation of hematologic pathology is a direct extension of these first principles of marrow histology.